Hello everyone, and welcome to another edition of Eye Care Today. I'm your host, Dr. Thomas Kislin, and we're coming to you from our Tannersville location, Stroudsburg Eye Specialist, located on Route 611 in beautiful Tannersville in the Poconos, Pennsylvania. Our phone number here, 570-421-3342. And if you're watching from the Hazleton area, our Hazleton location is Hazleton Eye Specialist, located on the Airport Beltway in Hazleton, 570-453-2020. Our website, www.drkislin.com. You can catch us on Facebook. Today we have with us a real special guest, Dr. Bellinger, one of our staff doctors in the Tannersville location. Actually does see patients in Hazleton also. So you can call and make an appointment with Dr. Bellinger. She sees all ages, but sees a lot of our pediatric population. She does a great job fitting contact lenses and treating eye diseases. And that's one of the things we're going to talk about today, Dr. Bellinger. So first, thank you for joining us today.
Thank you.
And coming in and sharing your expertise on this subject. Before the show, we were talking a little bit about emergency care and things that can go wrong with patients' eyes that aren't your typical just kind of blurry vision, needing glasses, needing contacts. And 10% of all urgent care visits are eye-related emergencies. So, you know, we see this a lot now where patients on a weekend, maybe it's after hours, have some sort of emergency and they go to an urgent care clinic. So what we wanted to touch on today was a little bit of what these emergencies might be, things that can happen that maybe are sudden and patients don't realize that they should maybe be coming to the eye doctor instead of the urgent care center for. So first of all, thanks for coming. And tell us a little bit about some of the things you see on an everyday basis as far as eye emergencies.
We see a vast number of emergencies, anywhere from visual symptoms to, pain symptoms in the eye. And there's a wide variety of things that, and some things people don't think are an emergency, but because they don't feel any pain, but they are, and it's something that has to be addressed right away.
So one of the probably most common ones that we'll see while we're in the office is patients call and they have big floaters in their vision or flashing lights in their vision. So explain kind of what that is and why that's an emergency.
So flashes can be a wide number of things. One of them is something similar to an ocular migraine, and it can be very worrisome at first, but after, we look at the retina. So the big thing is determining whether the retina is in good shape, healthy, before we can say, this is nothing to be concerned about. But there are a number of things that flashes can be an indicator of, and that's things like tears in the retina, holes in the retina, retinal detachments. And that would be an emergency. Those things would have to be treated right away in order to save the vision and preserve the vision.
Because a retinal detachment you can go blind from.
Right, so a retinal detachment is a ASAP emergency. You want to get in right away. We'd have to get you to surgery right away. And there's no pain associated with it. So a lot of people wait to see if these flashes get better, and actually what ends up happening is it makes everything worse. So yes, time is usually of the essence in things like retinal detachments.
And I know you're really good about a patient calls, and we tell our staff, patient calls with flashes and floaters, we say you need to come in right away. And you fit these patients in your schedule and get them the proper care they need. So flashes and floaters is a big one. What about your typical kind of red eye? Patient wakes up in the morning and all of a sudden one or both eyes are red. What are some of those things that?
Yeah, so we get concerned with contact lens wearers. If they wake up with a red eye, it could indicate things like infections from the contact lenses. Obviously allergies. This year has been a really tough season for allergies in general for everybody. Things like infections, both bacterial and viral infections, that can be extremely contagious, so that would have to be addressed. more, systemic like things, uveitis, iritis, those are inflammation of the lining of the eye that is often associated with systemic conditions. So red eyes can mean a whole skew of things, and that's why it's tough when people go to the urgent care, because it's very tough to diagnose a red eye. It's one of those things that has to be really carefully evaluated, look under specific magnification. We look for signs of whether inflammation signs, whether infection signs, and those are things that oftentimes the urgent care can't do. So their treatment is usually to start an antibiotic for a red eye, but oftentimes that won't get you anywhere. And another thing that a red eye could indicate is the herpes simplex virus or the herpes zoster virus, and putting certain medications on that can actually make that much, much worse, and we often see that.
Yeah, and I don't want to knock urgent cares at all. They have a very tough job in diagnosing some of these urgent type conditions. But as far as the eyes go, you make the perfect point. We just saw a patient last week in the Hazleton office where the patient had a red eye. Went to an urgent care clinic and they said it was a bacterial conjunctivitis. They gave her a drug called tobramycin. Didn't get better, in fact got a little bit worse, so then they called in a different drop that actually had a steroid in it, and it got much, much worse, and it ended up being a herpes simplex virus, which basically gets 1,000 times worse on steroids. Eat steroids for lunch basically, and that was very difficult to treat. So those are things that it could be something as very simple as pink eye, that we hear the garden variety viral conjunctivitis, or something very serious like that, like the herpes virus. So if it is something like a pink eye or bacterial conjunctivitis, what can we do for that?
So a pink eye can obviously be viral or bacterial. Most often in adults, it's viral. So there are some medications we can use to kind of lessen the course of it, but oftentimes it is let it run its course. In children, the pink eye can, usually be bacterial even, and that spreads very rapidly amongst each other as kids. And that we have medications that needs to be treated right away with an antibiotic.
So I think the key is getting the correct eye drop depending on what the condition is, because certain conditions, like you said, need to run its course. A virus just kind of needs to run its course, and we can give palliative treatment, maybe some artificial tears or steroids or things like that. But finding that right drop is the key. We're going to take a quick break. We're going to come back and we're going to talk more about ocular emergencies and what could constitute an eye emergency, and why, if you have one, you should give us a call and get right in. You're watching Eye Care Today, and we'll be right back. Welcome back, everybody. You're watching Eye Care Today. I'm your host, Dr. Thomas Kislin, and we're coming to you from our Tannersville location, Stroudsburg Eye Specialists, located on Route 611 in the beautiful Poconos in Tannersville, Pennsylvania, 570-421-3342. And if you're watching from Hazleton, remember our Hazleton location is Hazleton Eye Specialists, located on the Airport Beltway, 570-453-2020. www.drkislin.com on the web. You can catch us on Facebook. Today we're joined by Dr. Corinne Bellinger, who's one of our docs that sees patients primarily in our Tannersville location, but also now in the Hazleton location also. Dr. Bellinger sees patients of all ages, great with kids, does a lot with pediatrics. So Dr. Bellinger, thanks for joining us today. We were talking about eye emergencies, and that 10% of all urgent care visits are actually eye related, and that if anyone ever has anything that they feel isn't right with their eyes, that they should give our office a call, and we provide 24/7, we mentioned this before, but we provide 24/7 emergency care. One of us is usually on call, it's usually you, on call in the Tannersville area, and Dr. Diem is usually on call in the Hazleton area, but we all kind of rotate call a little bit. I'm a little older, so I don't do as much. But anyway, the great thing about that is if a patient has a problem on a weekend, where a lot of these things happen, they wake up on a weekend with a red eye, don't know where to go, instead of going to the ER or an urgent care, they can call our office and get the immediate care they need. So we were talking about different eye emergencies previously, and we touched on eye infections, flashes, and floaters, but I know the one thing you see a lot, patient is under their car changing a muffler or doing some work on their car, and maybe they don't have safety glasses on, maybe they do, and boom, they get a piece of metal in their eye. And that can be really painful. What the heck can we do for that?
Yeah, so the big thing is time with that as well, because any type of metallic foreign body, so metal in the cornea, can form rust. So the longer it's in there, the more rust that can form, and kind of the more invasive the procedure it is going to be for us to get it out. So time is of the essence. If that was to ever happen, call our office. We get you in that day for any type of emergency, and basically we get a good numbing drop on the eye, get you comfortable, and we kind of remove the foreign body, the metallic foreign body. If there is rust in the eye, I know a lot of people that have had metallic foreign bodies are always like, oh, do I need the drill? Do I need the drill? There is something called an algae brush that is similar to a drill, but it's made for the cornea, and we're able to kind of drill the rust out, and like I said, doesn't hurt. We get you comfortable. A little scary, but and oftentimes we put a bandage over that wound, that where the foreign body was, because it can be so painful to, the next day or so after it's removed. So we can put a lens on there to
So not like a
bandage it.
Band-Aid, we don't put a Band-Aid
We don't
on.
put a Band-Aid, no. So a bandage, what we call a bandage lens, is usually similar to a contact lens, and it's made to protect the front surface of the eye, the wound that's on the eye. Every time you blink, you won't be bumping that wound and creating some pain. There'll be a barrier there with a lens.
Okay. And how long does something like that take to heal, usually?
It depends on the depth of the wound and how large it was. Obviously, we put you on drops to prevent infection, because that's the cornea being opened up like that can be a breeding ground for bacteria, and that could be really detrimental to the vision. So we would put you on an antibiotic, sometimes even a steroid if there's a lot of inflammation on the front surface of the eye. So it depends on how large the wound is, but with a good lens, the right drops, a couple days to a week, I would say, to heal.
And like you said, comfortable, use an eye drop to numb the eye, not painful. Patients usually do pretty well after. We're now getting into the time of year where it's getting nice, people are cutting their grass and they're weed whacking. And we see a lot of emergencies from, again, patients maybe not having safety glasses on, and they're weed whacking, something flies up into the eye and either gets stuck in there or causes what we call a corneal abrasion. What's that?
Right, so corneal abrasion is when there's actually nothing embedded into the eye. There's no foreign body, but something hit the cornea and actually caused a wound on the cornea. And that can be extremely painful. The front surface of the eye, the cornea, is one of the most innervated parts of our body with nerves. So any type of injury or infection or anything like that can be extremely painful. Bothersome to light, you have trouble driving. So with a corneal abrasion, kind of similar to a foreign body, but we don't have any foreign body to remove, we can put a bandage, contact lens, or even a membrane, which is made up of stem cells that can help regrow that part of the cornea and help heal.
It's really interesting you mentioned that about the bandage lens and then the special medicine that's made of stem cells. Explain a little bit to folks out there what that is, because that's kind of new technology that we've been on the forefront in Stroudsburg and Hazleton of doing. Explain a little bit about what that is.
Yeah, so we refer to them as membranes, or they're considered amniotic membranes, and it's made up of stem cells. It's a tissue that actually, sitting on the front surface of your eye, is able to help regrow your cornea or the injury at a rapid rate, and it gives it all the healing properties it needs to become strong again. And that's something that can be very important. So oftentimes injuries to the front surface of the eye, if not treated right or healed right, can become recurrent. So these areas along the cornea that are weak can reopen every so often.
Yeah, and the thing with these injuries on the cornea, our cornea is clear, which is what allows us to see, and a lot of these injuries can cause scarring, which then can lead to loss of vision. So the point with the membranes also is that these membranes can prevent scarring. They prevent specifically something called keratocyte formation, which causes scarring on the eye. And scarring the eye is bad. So in combination with, like you said, steroid eye drops, these amniotic membranes can really not only help the cornea heal faster, more comfortably, but also without scarring, which is really important. Something as simple as weed whacking should not cause permanent loss of vision. So that's why it's so important if something like that happens on a holiday weekend or anytime that's happening after hours, the patient just give our office a call. They'll be directed to an after hours number, and whoever's on call will call them back and hopefully get them in as soon as possible. Sometimes things can wait till the next morning. They're not super emergent, but I know you're in a lot on the weekends and after hours seeing these patients, providing that service to our patients. So we thank you for that. We're going to take a quick break. When we come back, we're going to talk more about eye emergencies and the importance that if something's not right with your eyes, give the office a call, whether it's morning, during the day, evening after hours, or on weekends or holidays. Give us a call because it's something we might need to see right away. You're watching Eye Care Today, and we'll be right back. Welcome back, everybody. You're watching Eye Care Today. I'm your host, Dr. Thomas Kislin, joined today by Dr. Corinne Bellinger, one of our fantastic docs in our Stroudsburg and Hazleton location. Remember, if there's any questions, feel free to give our office a call in Stroudsburg. It's Stroudsburg Eye Specialist, located on Route 611 in Tannersville, 570-421-3342, and in Hazleton, the Airport Beltway in Hazleton, 570-453-2020. www.drkislin.com. Catch us on Facebook. Dr. Bellinger, we were talking again about eye emergencies, and that just to give an idea of how prevalent these are, 10% of all urgent care visits are eye related. So, it makes sense that if patients have an eye emergency, they can give us a call also, and we'd be glad to see them either during office hours or after office hours if it need be. One of the other things we'll see, and I sometimes see this more at Christmas time, but it can be any time, people who are out hunting, things like that, is like a pine needle in the eye or a tree branch scratching the eye. Tell us a little bit about that type of injury.
Yeah, so any type of injury with what we always refer to as vegetable matter or tree branch, things like that, is something we have to be concerned with. Fungal infections, that's a big concern. So even though it might seem kind of innocent to have that happen to you, fungal infections can be really, really dangerous in the eye. And we've had people that have had to have their eye taken from them just because they've had these types of injuries that seem so innocent, but the fungal infection can really damage the eye.
Yeah, and the problem with fungus is, as you know, again, if a patient is not seen by an eye care provider and they're given the wrong type of drop, maybe a steroid, and that's put on a fungal infection, it can go bad really, really fast. And like you said, can lead to the patient actually permanently losing vision, actually having to have possibly their cornea or eye removed or something like that. We see those types of injuries sometimes around Christmas time, patients putting up their Christmas trees, taking down their Christmas trees. Sometimes we'll see in the summer around 4th of July fireworks. Fireworks go off and the debris can go up into a patient's eye if they're playing with firecrackers or things like that. The other one we commonly see are contact lens related problems. There are contacts out there that are approved to be slept in. However, I'm personally not a huge fan of extended wear contact lenses, sleeping in lenses. But what are some of the things that can happen if you sleep in your contacts when you're not supposed to?
Yeah, I'm not a big fan of the extended wear contact lenses that you can sleep in, because it's always the patient that comes in with a problem that has slept in the contact lenses. Almost always it's been some sort of overwear or kind of misuse or poor hygiene of the lens. And I always think if you get bacteria trapped between the lens and your cornea, that bacteria is going to start to feed on the cornea itself. So that's where it's going to get its nutrients from. So a lot of the things with contact lens infections are ulcers, which can be extremely painful, which can also scar and permanently reduce your vision if it scars in the right spot on the cornea. And that's something that has to be treated pretty pretty aggressively at first, a central corneal ulcer from a contact lens.
Yeah, in the old days, those ulcers would be cultured, and then we would send the patient to the hospital and do IV compounded antibiotics. Thankfully now there's antibiotics on the market that have what we call broad spectrum coverage, where they cover a lot of these typical bugs that cause these types of infections. So hospitalization is usually not the case, thank goodness. One of the other emergencies we'll see a lot of times are new bumps that grow on the eyelid. What are they called?
So a lot of people refer to them as styes. They can be extremely painful, and a stye, or the medical term for it is a hordeolum, would be an infection in the gland that produces part of our tear film, and that can be extremely painful. Extremely painful. It can make your entire eyelid swell shut. And they often need an oral antibiotic because those glands are only really receiving blood supply through that's how the medication would get to them, is through that blood supply. So these can be bad, and left untreated, these can lead to infections that spread behind the eye or even towards the brain. That could be very serious.
Yeah, that's a great point, because a lot of patients, they'll get these little bumps on their eye. They start small, and then they'll grab some neomycin ointment that's been sitting in the cabinet for a while, or maybe their kids had from pink eye, and they put it on and it doesn't work, and now this grows and gets bigger, it gets redder and more painful. And the term is preseptal cellulitis, and eventually cellulitis, like you said, where the infection can pass behind the eye. We think we've got the eyeball, we've got the sinuses, and then we've got the brain. So there's not, the path to the brain is not far, and these infections can be very, very serious. So the oral antibiotic is very important. And again, we see patients that maybe go to the ER or go somewhere not to an eye care provider, and they just get an ointment and it just doesn't clear up. So make sure to call your eye care provider for those types of conditions. The last one I want to touch on is a case that we just had the other day, and this can go some different ways, but the way this gentleman presented was all of a sudden woke up and the vision was gone in one eye. And we looked in the back of the eye, and the optic nerve was swollen, and there was a lot of blood in the back of the eye. And this is called a central vein occlusion. Explain to the folks out there a little bit about what a central vein occlusion is and why that's an emergent situation.
So a central vein occlusion is a blockage to the main drainage system of the blood from the eye. So if this is blocked, or oftentimes certain embolisms or thrombosis, we actually can't get our blood out of our eye. It's still being pumped in, but we can't get the blood out from the retina. And that can be really, really, really vision. It can really affect your vision really quick. Like this man woke up and he couldn't see. And that's something that has to be a systemic workup. So that can be, we have to work you up for it can lead to strokes and other things throughout the body that has to be evaluated.
Yeah, and a lot of times with these types of patients, we'll see that their blood pressure is extremely high. They'll come in and we take their blood pressure in the office, and it's maybe 160 over 110, and that's the reason for the vein occlusion. But in this gentleman's case, his blood pressure was not very high, which made us suspicious of, kind of like you said, a thrombotic situation, possibly something else going on. The risk of stroke is extremely high. So the gentleman wanted to drive to the hospital. I didn't want him to drive. I wanted to call 911, and we'll actually do that. We'll have 911 come to the office and transport the patient right to the hospital. He agreed to have his family come and get him and take him to the hospital. And the thing that we can do is we can coordinate with the hospital. Then we call the hospital. I actually spoke to the attending, and I said, listen, we have this patient coming. This is what they have and this is what they need. Because a lot of these patients enter the ER with blurry vision, and the ER is great at managing strokes and heart attacks and things like that, but the eye can be confusing for non-eye care docs. And patient can be there a long time and have things done that maybe don't need to be done. So we were able to streamline with this patient and get him the proper testing, the scans, the needed CT scan, blood work, echocardiogram, EKG, so on and so forth. Turns out everything was good, and now the gentleman we need to manage his blood pressure a little better with his family doctor, and he's going to be fine. So again, a type of emergency that maybe the eyeball's not red, but they just lost vision. So the moral of the story, as Dr. Bellinger was telling us folks, is that if you have any eye issue that doesn't seem right, red eye, pain, loss of vision, blurry vision, give our office a call. We're here 24/7, mornings, evenings, after hours, weekends, holidays. Give us a call. We're here to help you and make your vision better. You're watching Eye Care Today. That's it for this show. We'll catch you next time. Take care.